papa enka se na nia ha anase no ho ye ne mreda sanam papa ne fia konkan ono so nkompreni da se ne ho ba bia ne ya osori anopa na no afanse kan no okonefu me akrobeto madwuma meye me kan news na me acte na me kobeba ta biara no ebere me de bedampo na ade ase nanso me nsori da krokran ka se me ho ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa meshakurani eyaduru a onomu a ebo ni padua no ema wo se pi usita me kanfo ama wo se won so no no kowa mesani bi na ba boa na aboa no obusua na yareda ho eya nunum bi na obedia danse obenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. So wo pe kwa mixture ato e America brochi memu a One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonana Feno Agenda, it was 0773-610-1112.
kowa mesha abusua ahuntasem
FDA ahwehwe edwadie nkratuo yi agiatum se eye.
Wow. Me pa na fi ma file me tax nkunim dia kwa mami. Na ene se afenu akwa wiye me tax file na beye me asompidie ene nkwada na. Nanso with akunim and associates say die menyo butantim e me tax issues ahodio nyina mu. Onua wow anything e was how file or tax with smile. IRS for editable atoso. Womu hunehuna womu tata wo file or taxa. Dabia da uboka usika unya ekitu ebi. Make no mistake. Fahobo Akunim and Associates. With Akunim and Associates, what tax filing ebedano S gratia ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing. And NSM, Akunim and Associates. State Bia Iowa America. Mono mepacho womu ewo gidie anamon kwan paswa wombetimi atu akohwe nkwa ewo tax filing enti bebe bia wo bia utimi ene Akunim and Associates etokese na jumantia obonti Akunim and Associates edi obia de friend se owura agenda na chese wakodare mu aben ewo tax filing fa wo bedan wo mo hwehwe wona chi kwan ewo offices ahodoa edidi suwe. First location 684 West Boulton Road, Suite 201, Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchaf Wonum Ewo. Telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-247-3454. I feel bit my emailing on akunim.info@gmail.com. Akunim and Associates, yes, Nukrenie, open kunim die, our tax mudia. This all took us with Akunim and Associates. ANG Unkwa.
Yo, Yamamo, Akwaba, Eba, Ako Radio. So, I health and wellness, and Masuguso and Mutie. I do Sunday say from 10 to 12 Chicago time, and I just say, Jumadia de Bremone, health and wellness. And, we are some, that's the only show, that time period, and on T. I do Sunday say, and I just say, you call a friend to tune into Ako Radio. Your Facebook, your YouTube, your social tuning, baby, episode will be on your. I don't know, Yansaka, Dr. Okoe, I don't know about you, come more, Fibroids and Infertility. I intimate shall say, we're buying faster than more trading for young coupons or buying, or the accord the abba. For some year, you know, Anna Dr. Fury and Tim Mammy, Dr. Fury, Cinema Dana baby. It's not my Saba, I'm a back in tea. I ceremony, your Bible twasso. And I answer now, be able to drink at all, but but say you introduce you Dr. Okoe. Now you bar, not just say you commercial and bar, not just say no. Fibroids and Fertility in Abram. Now no, you show no by a brofo. And to some to say a puta and I want to say not trust no church but they are between you sometimes they are limited. Jamo function. And see, I mean introduce you Dr. Okoe. Yamana Kwaba. Dr. Okoe, good morning and how are you?
Good morning, sir.
How are you doing today?
I'm doing well. How are you?
Well, by the grace of God, I'm still alive, so you know, I'm doing good. Yeah. So just like I was telling my viewers that today's show is going to be, a little bit in English, and I'll try my best to, do some translations and some paraphrases and other things. So,
okay.
Well, but before we start, we're just going to go for a quick commercial break. And when we come, we start with, fibroids. Talk about what fibroids are and, how, they're developed and stuff like that. So we're going to go for a quick commercial break. When we come, we're just going to talk about fibroids.
Just one more pic, JJ, please.
Oh, Mama, really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.
World Remit, a better way to send money. Download the app or visit worldremit.com.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
All right, welcome back. So, Dr. Okoe, we're going to start with fibroids. So, someone will ask, what actually is fibroids?
Okay, so before I start about what fibroids what the womb looks like, then I would. So if you can think of a light bulb that you put in the actual light fixture, and the shape of your uterus, okay, or the womb that we call it in layman's terms. But so the top, the part that lights up is actually upside down inside of the female. So when in that womb is where, but the womb is actually a giant muscle, like the one in your arm or in your leg. And what happens, especially when you're having a baby, it starts to contract or it starts to move back and forth. And that's how you're able to actually deliver the baby or bring the baby out. So one of the cells grows into a ball. Okay. So it could be a little ball or it could be a big ball. Ball will determine what kind of problems you have. Okay. So fibroids in general, about 99% of them are non-cancerous. It doesn't cause any cancer. But the problem is with fibroids, once again, depending on where it is inside of that light bulb, the problems you have. So if that ball or fibroid is inside the light bulb or the womb, you get heavy bleeding during your periods. Okay. You have a lot of pain or cramping during your periods. Okay. And because of the pain and the bleeding and the cramping, that leads to other problems, like you feel very tired, very sleepy. You look like your skin looks pale, or it looks gray. Okay. And then sometimes you feel that your heart is racing. When you walk just short distance, sometimes you feel very tired. Okay. And then the pain, it could be mild pain, it could be average pain, or it could be severe pain. People to take off of work or school because of it. All right. Sometimes that ball or that fibroid can be on the outside of the light bulb. And when you have on the outside, you won't have so much of the bleeding problems or the pain. But the problems that you may have is that you find women have big stomach. That's one reason. The other thing is sometimes want some women urinate or go to the bathroom very frequently. Fibroid on the bladder. Sometimes they have constipation, once again, because the fibroid is pressing on the actual bowel. So just depending on where it's located and how big these fibroids can grow, that's what causes a lot of the problems that a lot of women have when they're told that they have fibroids. Now, fibroids in general are very common in women. Okay. So, and if you take all women around the world, 1 out of 2 women will have fibroids. So that's about 50% of all women. But when you get to women of color, okay, especially Africans, that number goes up to 80%. So if you have 10 women in a room, 8 of those women will have fibroids. Now, all of those 8 women may not have problems from the fibroids, but they will have fibroids. Okay. And the average time that people will start to know that they're developing fibroids is when they get to about, I would say, mid-20s. Okay. And then 30s. And then definitely by the time you get to your 40s, women that have fibroids, by that time they've grown for so many years that, they have a lot of the issues that I discussed earlier. And so by that time they go to the doctor, and then it's at that point they'll start to tell them that their blood is low, their belly is big. And then that's when they start to talk about surgery to remove the fibroids.
Wow. We've talked about that in a different, this is our second time talking about fibroid, but this is a different picture that you've given us. Like, like a light bulb, and,
Yes.
it depends where it is that causes the problem.
Yes.
So my question is, we're going to talk about what actually is the fibroid, but you're talking about the inside and outside. So my question is, so which one causes more problems? Is it the one that is inside or the one that is outside?
Actually, the one that's inside causes the most problems, because once again, that's the one that causes more of the bleeding and it causes more of the pain. Okay.
And which one causes infertility? Is it both?
So the one that causes the most problems is the one on the inside. So I drew a picture here. I don't know if you can see it.
Oh yeah, you can see it. Yeah,
you can see it. Okay, so you see how it looks like a light bulb upside down. Okay, so this is the inside of the light bulb or the womb. So when you have a fibroid that's here, right? And these fibroids can be as small as a dime or a coin, and these fibroids can get as big as a baby. Okay, so a lot of times when it's small, if it's inside, that causes the most problems because you get a lot and you get pain.
I see.
Yeah. So, and then as they get bigger, because the only way to get rid of these fibroids is actually to take it out. Okay. But depending on the size of the fibroids, you know, if they're small and they're not giving any problems, we don't do surgery. We kind of just tell you, okay, we'll just watch it and see. Okay. To kind of slow the growth of the fibroid. Okay, but it never take it away. It would never just dissolve and go away on its own. Okay, and if age of menopause in this country is 51. Okay, so some women, they've had fibroids, they've had no problems, and then they turn 51, they stop having periods, and they go into menopause. Those fibroids that until they die, and that's okay because, like I mentioned before, 99% of these fibroids are not cancerous. So we don't even worry about them. Okay. Only time we really worry about them is once again, if you start having pain, you have bleeding, right? Or you notice that, okay, you can't eat. Then we have to go in and look and investigate to find about fibroids is if we do an ultrasound. So if you come to the doctor and you're like, every month when I have my periods are very, very heavy. Okay. The first thing we do, we'll check blood to see how low your blood count is. But the most important thing after that is you do when you're looking for a baby to see how big the baby is or the gender. We do the same thing for fibroids. So they may do it on top on the abdomen, and then that's when they're able to see where these fibroids are.
I see. You know what? I didn't even ask you to introduce yourself. I just forgot. So I want to do some translation. So I just wanted to introduce yourself. You know, if someone asks you, I mean, who's Dr. Okoe? I mean, what are you going to say? I mean, where did you go to school? Yeah, I mean, we want to know everything.
You want to know everything. Okay, yes. So my name is. My parents are both Ghanaian. Okay, both of them are Ga. And so they've been in the United States since my dad's been here since the 60s and my mom since the 70s.
Okay.
I was born in Chicago itself. I went to University of Illinois for a bachelor's degree. And then I went to medical school at Rush University. And then I trained to be an obstetrician gynecologist at University of Chicago. So to go back, I actually was before I went to medical school. And so I've been out of training now from medical school or from residency or to train as an obstetrician gynecologist. So I moved out of Chicago and currently I'm living in Elgin, which is 50 miles northwest of Chicago, 30 miles west of Bolingbrook. And so I work for Advocate Aurora Health at the Sherman Hospital here in Elgin, Illinois. So that's a little bit about me. I'm married, but I'm Nigerian, and I have 3 children.
All right. Thank you so much. That will help me with my little bit of translation. Well, I say for Dr. Okoe and then Chunkomono, I will say I never party about Krumhache ye, chapa be 60s, my 70s. Just say, mobile hand bugger 4 pound. I'm no. I hear the say by and change here, the bugger 70. The bugger 4 pound. Now, Pacha said, yeah, when we Chicago, and I just say, Okoe University of Illinois, they were Urbana Champaign, right?
No, Chicago campus.
Chicago campus, okay. Okoe UIC, actually. And I just say, about in the Aboni, Wakwa Baye, why in the residence, you say, why will be a trained, our a gynecologist. I just say, and my would man warrior. He said, no, was one mommy and son. To when I just say, I mean, will be a show you with me questions be an with me here no my Dr. Kwame was a baby. Now you beside us a fibroid and no there no waiting I can find. Also, well, answer a corner over fibroid once a more. I was so trained, said a fibroid nankasa cry city. And now what it's a light bulb. It's a light bulb, no, but be a switch no, I say. And see, I'm a name says a hand was at each no. Also, it's a light bulb, and so her says you turn it upside down now. But the fibroid, a bit to me or outside, and this to inside the light bulb. The light bulb on the Manu uterus, no, the actual sign. And see, or by the fibroid, no, the inside and the other happening inside, no, and the other cause more pain, and I feel so, it causes more bleeding, and no troublemaker. No. But it also, man, over more, 50% ebenya fibroid na you know your African phones so they are let's just say 80 to 80%. And teachers say Ushima or let's just say a man uno bia na mwa baby na mwa let's just say ujimu ba ya let's just say most you know bia obabia or fibroid but the no children say nyina na ema problems until ebi one my nketinketi ebi so a ya kakraka. It's not my problem. Now, my problems, I just say, a buana a cocoa you through. A boy was necessary, and I say, no, and my problem be a mutimi jam and all. No, Casabia, I started with, you know, start from be about 20s, 30s, you know, maybe only 40s, you know, and that is a be an I full blown fibroid. I say, the hospital. I'm a doctor for no with me, and her no more boy. And you know what, some I can't, Mrs. Sumichi Mukakran. I hope say my church will come out. And to Dr. Okoe, I think you know if you understand Chi, you would be able to know that I actually did my best.
Okay. I heard it seems like you're exploring it very well. So
I was flowing very well, right? So
yeah, it was flowing very well. You may take my job one day. That's not...
no. Well, so let's come to the big question. So, we know where the fibroids occur and what they actually do, but what actually is the fibroid?
What actually is the fibroid? Mm-hmm. So the fibroid is actually a muscle that just developed into a ball. That's all the fibroid.
Yeah, I think your internet kind of goes in and out, so sometimes you can barely hear you. And now you're frozen.
Okay, can you hear me now?
Yeah.
Okay, so the fibroid, all it is, muscle that's just in a round ball. That's it. So it's balls. If you think about it, it's a ball. That's all it is. It's ball, a muscle. It turned into...
Yeah, you said it turned into what? Because I couldn't hear that part.
I follow a muscle. That's it. And sometimes they just get hard as a rock. Or sometimes you can have one fibroid, and sometimes you can have many fibroids. Okay, so like, you know, if you were to come to me and I find that you have fibroids and I have to do surgery, sometimes I'm just taking out one big fibroid, right? And sometimes I could take out as many as 20 fibroids, right? We don't know. Unfortunately, we don't know why certain people have fibroids and why some right. And so they have different why, but nothing has turned out to be, okay, this is the exact reason why these things happen, right? And so for the most part, we just kind of address the issues or whatever problems people have, and then we just go.
Okay, so let's talk about the causes. I mean, what actually causes the fibroids? I know you said it's a muscle that forms into a ball. So what actually causes that muscle to form into that ball?
We really don't know. Sometimes we know. What we do know is that it responds to hormones. Okay. So, you know, when it becomes that your and when it's progesterone, right? And so we know for sure, like as women, the only time these things starts is once you become a woman, right? Once you start having periods. When a girl first start having their periods, it normally starts in their 20s. And then as they go on and have more, you know, as they continue to cycle every month throughout, bigger and bigger. But we don't know. We have no idea why certain women have fibroids, and that's what causes them to continue to grow.
Okay. So, I mean, needless to ask this though, but so men do not have fibroids, right? Because you're talking about, okay.
Men don't have fibroids because they don't have a uterus. They can't have babies. So, yeah. So
even if you're a man and you turn into a woman, you still cannot have fibroids, right?
No, if you don't have a uterus, you can't get fibroids.
Okay. All right.
Yeah.
So let's talk about, you know, what fibroids can do to the body. What actually can fibroids do to the body?
Okay, so the fibroids, I guess the good thing about fibroids is they don't travel to other parts of the body.
Okay.
So you won't find a fibroid. Right? So it won't travel to the heart, it won't travel to the lung, it won't travel to the stomach. It'll just stay right. But the problems are how you get the problems is what other things are surrounding the uterus, okay? And then also because of the uterus itself, because women have menstrual periods every month, they bleed every month. If those fibroids are in the way, instead of the woman maybe bleeding, let's say 1 ounce of blood, ounces of blood, okay? And so what happens, the blood count just gets lower and lower and lower to the point that the woman becomes anemic. You just feel very tired. The amount of blood in their system is very low. And the blood, so just to give you a reference, we have numbers. When we draw your blood to see how anemic you are, we look at the red blood cells. And in some women, because they bleed so heavy, have half of their blood volume, right? Because of just how heavy their periods are. And as a result, having half of your blood volume affects how your body works. So that's why some people, they find that they very tired, right? Because they have the blood volume. Sometimes they get a lot of headaches. Sometimes they have facing. So they'll just feel like, you know, when they do something very simple, like even washing dishes, catch the bus, they can't catch their because their blood volume is just that low.
Yeah, we're gonna take a quick commercial break, and Dr. Okoe, look as if your internet keeps bouncing in and
freezing.
Out. Yeah, so we can, sometimes we can barely hear what you're saying. So we're gonna take a quick commercial break, and then see if we can if there's a way you can maybe work on that.
Change my end. Okay.
Yeah.
Okay.
All right. So we're going for a quick commercial break.
Minia ba eni ma medufi oye djuma odukasi anopa biara minia ba sori ahoɔden mu na ɔkwadwuma on complain da sɛ ho ba bitutu no sanso na mebra o efitani o tu engine na o pagya engine de ka adwuma sɛ de sitie da bi biara no ho dendenden mia meyire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanem papa ne mfia konkan ɔno nso complain da sɛ ho ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meye me kan news na me acte na me kɔbeba da biara no ebra me de dampo na adeas nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gina se your secret ahuntasem duru a de boy ho ba ne nyina ni kowa mesha kurani duru a wonom a ebo nipadua no ma wo si pi wo sita me kanfo ama wo se won so no kowa mesha ni bi na baboa na aboa no abusua na yare da ho eya nunum bi na obedi adanse wo benya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. So wo pe kwa mixture ato ewa America brochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusua ahuntasem.
FDA ahwehwe edwadie nkratuo yi agiatum se eye.
Wow! Mepa na fi ma file me tax including dia Kwame mi. Na ene se afeno akwawiye me tax file na beye me asompidie ene nkwadana. Nanso with Acronym and Associates say die menyo butantim e me tax issues ahodio nyina mu. Onua wow anything e was file or tax with smile. IRS for editable atoso. Womu hunehuna, womu tata, wo file or taxa. Dapia da uboka, usika unya ekituebi. Make no mistake. Fahobo Acronym and Associates. With Acronym and Associates, or tax filing, ebedano S gratia, ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing, and NSM, Acronym and Associates. State BIA, Iowa, America, Kroponimono, Mepacho, Womu, Ewo, GDA, Anamon, Quine, Pasua, Wombetime, True, Akoshem, Ewo, tax filing. Ain't baby BIA will be a Utimi, any Acronym and Associates, Etokese. Najuma Dia, Obonti, Acronym and Associates, a deal BIA the friends Ura gender, not just say, Wakudarimu, Abeng, Ewo, tax filing. Fawobedan Womo, Shishawana Chi, Quine, Ewo, offices, Audua, Edidiswe. First location, 684 West Boulton Road, Suite 201. Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchaf Wanum Ewo. Telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-247-3454. I feel bit my mailing on acronym.info@gmail.com. Acronym and Associates, yes, Nukrenie, open kunim die, our tax mudia. This is what took us with Acronym and Associates. ANG Nkwa.
Welcome back. I think now we can see Dr. Okoe clearly, and I believe the internet is going to stay on for us so we can discuss this very important topic, because this affects a lot of women. Like she said, 80% of African Americans. So that's a great number. So it's worth discussing. So Dr. Okoe, I know you talked about the effects that it can have on us. Oh, okay. I see your son there trying to be part of the show.
Sorry about that.
No, that's fine. We all know, COVID season. Sometimes you'll be at work, you'll be having a meeting, and then all of a sudden, these kids, they just jump onto it and stuff like that. So at this point, we all know what to expect when we're doing shows like this. So we will jump onto infertility, right? Because I know fibroid kind of play a role in infertility. Right?
It does.
So can you tell us something about infertility and how fibroids are playing a major role in that?
So sometimes the role that fibroids can play in infertility is that depending on where those fibroids or those balls are, right? It can interfere with implantation of the actual fetus or the embryo. So the egg and the sperm, once they try to implant, this fibroid may be in the way, and so then that can be a source of infertility there, right? So it's just almost blocking the ability of this miniature baby from implanting there. But in infertility itself, that's just one small area that could interfere with individuals not being able to conceive. Infertility itself, there's so many factors, and a lot of times we always focus on women, and maybe being a primary problem in infertility, but the factor is actually 50-50, right? So, they'll normally say, it's 40% women, 40% men, and then 10 to 20%, it could be anything. Okay. So, but if we're going to just focus on the females right now, infertility, it could be, we have to look at the woman's history to kind of determine like what could be those issues. And so, depending on the age of the woman will determine when we start to evaluate for infertility. If you try 1 or 2 times, you're like, oh, wow, I'm not getting pregnant. That's not necessarily infertility. Okay. So infertility, if you're less than 35, if you have to at least been trying for 12 months, right? And
when is it trying? What do you mean? Like
actively trying to get pregnant, right? So every month, you try to get pregnant and nothing happens, but it has to be for 12 full months before we can officially say, okay, I think there's a problem and we should evaluate. Now, obviously, if you're over the age of 35, time is not on your side. So if let's say a lot of women, because of, a lot of women now, they're delaying getting pregnant for multiple reasons, mainly because of work and school. So, and then they may not find a husband or a partner until later in life. So like once you get to age 35 and older, right? If we shorten the time duration as to when you should start seeking out help. So in those women 35 and older, if you're been trying actively for 6 months and no chances and you're not getting pregnant, then we all normally say you need to seek out medical attention so we can figure out what the problem is. Ideally, we want to see both the man and the woman, because once again, infertility is not just affecting the woman, it can be a male factor too. So we have to evaluate everything in as a whole to actually determine why there's a problem and why, this couple, because we see them as one unit. It's not just a woman, but as husband and wife, man and woman, whatever. We see them as a whole to determine where the problem is coming from.
Okay. Yeah. So today's one is going to be pretty much about like you mentioned, like women, and then how fibroid play a role into that. So
yes.
my question is, I've had people say, oh, I had a child and then I've tried and nothing is happening again. Is that a problem?
That is a problem. So once again, let's say you've had a child, right? So women has had so when in medical terms, we look at that matters a lot. So we look at, okay, if you've had a child before versus you've never had children before. Okay. So if you've had a child before and then you've tried for 6 to 12 months and you can't get pregnant again, then we call that secondary infertility, right? So we have to look for what could actually happen. What is the cause? So in that case, I won't say it's easier, but at least you've proven yourself that you were able to have a kid before. So now we just have to look at what happened from the time you had that last child until now as to what the problem is. Okay. But for women that's never had a baby before, never been pregnant before, now that can be a little bit more challenging because we have to look at other additional factors as well. Okay. So for women, like I say, even though the topic today is fibroids and infertility, yes, fibroids can interfere with getting pregnant, but there's also so many other things that we have to look at to determine what is the problem. Because sometimes it may not be the womb, right? So what we look at, because with the female anatomy that I drew before, and if you like, I would actually come back to the show and actually have better images. I apologize. I've been sick for a month. So I wasn't really, I didn't prepare as much as I would have. So if you like, I'll come back and explain it more.
Yeah, we will take you up on that.
You'll take me up on that offer. So I'll do this again. Okay. So just for the female anatomy, so I'll draw a picture. So this part here is the cervix, right? So that's the entry point for the sperm to get inside the womb. So that could be a problem. And then the womb itself can be a problem. So the womb or the uterus, that's where the fibroids become a problem, okay? So that's problem number 2 could be there. Problem number 3 can be the fallopian tubes, okay? So this is what brings the egg into the uterus. If this is blocked, you can't get pregnant.
And can you have fibroids in the fallopian tube also?
No, not really. You can have it close to you can have it very close to the fallopian tube, okay, but it won't be in the fallopian tube because the tissue makeup is completely different. So every part of this of the uterus of this woman anatomy has a different cell, right? So they don't all look alike. So fibroids, for the most part, only lives from here to here. Okay. Now you can have a fibroid that is so big that it kind of blocks this place. And you can have a fibroid that's big that it blocks this place. Okay. But it only kind of stays, the fibroid develops here, and then they can just kind of compress or squeeze certain areas. Okay. And then the 4th part is the ovaries, right? So it's this thing here. So when we do infertility, we have to look at all of these. It's like it's as if it's 4 different areas. So we have to look at that. In addition, so this is just in the female inside the pelvis. Yeah. Now there's other issues. So if you have, let's say if you have thyroid problems, right? Now that's in your neck, that can cause you not to have infertility. Let's say inside the brain, actually the hormones that you produce, everything is controlled in the brain. So if some part of where the hormones or the signals come from in the brain, if there's a problem there, and sometimes you can have like a bump there or oversupply of certain things that cause everything downhill not to work. So that's why we have to go through all these different areas to see what could be the problem. It could be infection, an old infection from when you were 18. It could be, let's say some people, like when they were children, they could have had some kind of medication that interfered with their ovaries. So, we have to kind of get a very detailed, history, or, ask a lot of questions to see, okay, what could be the problem? And then even once we get the information, we can do other tests to kind of see, okay, maybe it's this the problem, maybe this the problem. Some of the things we can fix, right? And some things we can't fix, okay? But, a lot of times, the evaluation can take, sometimes if it's a simple fix, we go in and change, fix it. Like if it's a fibroid, if we look at everything else and it's a fibroid and we shave it down or take it out, and then you get pregnant, we fixed it. So that's a quick fix, right? But sometimes it may take us up to a year to find out the problem. So, it's just, we go through, it's step by step, we kind of figure out what the problem is, and then we go from there.
Okay. So my question will be, you mentioned that, 50% of all women will have fibroid, right? And then for African Americans, it's like 80%. Why is that difference?
Why is that different? So they don't know that. So when they look at one point, one of the theories they look at is our diet, Okay. And it's not, it's not the usual, oh, you eat too much fufu or, palm nut soup or something like that. They were thinking, at one point they was thinking is maybe our yam intake, right? Because yam, when they look at one point, some of the hormones or birth control pills that we take, one of the they actually developed it from yams years and years ago, right? So they were looking like maybe our dietary intake of yam may be interfering with the fibroids. But then when they look at it, so okay, if you look at Africans, right? West Africans, we eat more yams. Yeah. But then when you look at Black Americans, they don't eat any yams. And we're not talking about sweet potatoes either. So that's where they're saying, okay, this is not, even though this is a theory, it's not holding water. So they still at this point in day cannot figure out why. All we know is here, and we just have to figure out what do we do about it. That's it.
Okay. Does genetics play a role in this?
Genetics do play a role. So like, let's say if my mom had it, my aunt had it, my sister had it, more than likely you're going to have it. Okay. But just because all three of us have it, how we display, how the symptoms come or how much of a problem is, it would differ between all three of us. Now, my mom may have had very bad fibroids where they're bigger and she bleed more, whereas I may have it and I won't even know that I have it. So even though it is genetically linked, it doesn't mean how it display itself will be the same among all of us. So.
Yeah. So let me ask you this. So how do we treat fibroids? I know you mentioned surgery, but is there a way that, maybe you give some medications that will actually shrink it or other things?
So one thing I have to tell, it's never going to go away. Only way you can get rid of it completely is through surgery. And even then with surgery, right, it may remove the ones that's there. But as long as you keep having regular menstrual periods, you're going to get more, right? So a lot of times what we like to do is, especially if we find that it bothered you for so long, and then we give birth control pills. Because remember, the fibroids only respond to hormones, right? So and then funny thing is, you can get pregnant and have fibroids in place, okay? A lot of women can have fibroids and still get pregnant, okay? Even though it can be a point of infertility, but as long as it's not in a way of where the baby implant is fine, and you can have fibroids. So fibroids in pregnancy is common. And some women, it don't bother them in pregnancy, and some women it's a very big problem. Okay. So the reason why it's a problem in pregnancy is because your hormones that's supporting a baby is like 10 times the normal level. So now these fibroids are growing even bigger. Okay. And now they're causing more pain. And so then eventually, it's very hard to manage fibroids in pregnancy because the medicines that we normally would give to treat fibroids, you cannot give for the baby's sake, right? But if you're not pregnant and you have fibroids, there's different medications, and some of the medications work on the fibroid itself, and some of the medications just work on the pain, and then some just work on the bleeding. So it just depends on, which medication is best for the patient. So we kind of look at everything. But in general, the one medication we like a lot of gynecologists or even general medicine doctors and general practitioners we will work with is giving hormones or birth control pills, because that's the easiest thing to manage. And it actually works on treating a lot of other things, not just the fibroid, but it can control the bleeding, and it also can control the pain.
Yeah, I mean, Obi, good morning. OBG series. He's asking. I know you talked about that, but I think he came in late, so he's asking that if fibroids have any relationship with painful menstruation. And I know you touched on that, but can you?
Yeah. it plays a big, like, if you have fibroids, right, and you find that you have very bad periods, there's a direct link. As a matter of fact, it's probably one of the causes of your painful periods. So, a lot of times with the pain, it could just be location of where the fibroid is in that light bulb, or the size of it. Okay. So, I mean, when depending on what the size is and how much pain the woman is having, sometimes what we try to do is, like, sometimes we try to stop the periods altogether so that she doesn't have the pain, if that's something she likes. But if it's something that's interfering with her work and her job, and we find that the fibroids are actually big, then we can even go in there and remove it to try to help with that pain. Yes.
Okay. So
but I won't say fibroids. Okay, I'm sorry.
Yeah, now go ahead.
I even though fibroids can cause pain, I want people to understand that's not the only reason why you have pain in your periods. Okay.
Yeah. So I know someone that, they said, she had a fibroid, and then they went in, they took it out, but it came back.
Yeah.
Why is that?
Because you're still having periods. Because let's say if you're 30, if they went in, let's say you were average 38 years old, right? And we know here in this country, the average age of menopause is 51, right? So if you go in at 38, remove a fibroid, you still have 13 years that you're still having regular periods. So it's going to grow back, right? So only time is don't grow back at all is if you remove the entire uterus. And that's what's end up happening for some people, because that's probably the best option, especially if you're done having children. If you're done having children and and this bleeding and this pain is causing you so much problems, right? What's the point of keeping it? A lot of times we'll just remove it.
But wouldn't that cause any issues when you take out the uterus?
Well, the thing is this: the main reason for the uterus is for you to have babies. That's one of the primary functions, right? So for women that are not done with having children, right, then that's a problem, because we have to try our best to try to manage it, right? But once you're done having children, and this continues to be a problem, because like I say, if let's say you've had fibroids at 38 or 40, and we go and we remove the fibroid, right? Guess what? There's one that's going to grow again, because you've had this history of it growing, and you're still having regular periods and in response to hormones. So, within another 5 years, you're going to have another problem.
That is true. Well, we just want you to know that, Dr. Okoe and the Ghanaian Community Health Clinic, they're having a series this May, I think May 14th, right, Dr. Okoe?
Yeah.
And then, yeah, go ahead.
No, keep going, and I'll explain more. I'm sorry.
So if you go there, you're going to see Dr. Prince Hodogwe, Dr. Jamila Okoe, of course, who's going to talk about OBGYN and other stuff. And then Dr. Eunice Cromwell is also going to be there. And our own Dr. Fori is also going to be there. And Dr. Habiba Fuseni also going to be there. They have a brown bag event. They also check your weight and BMI and other things. They also give you counseling on your nutrition, which most of us need. And also, they'll check your stats, like, hypertension, diabetes, and cholesterol and other things. And they also consult you on travel medication, which I think most of Ghanaians that travel outside, they really need. And then they also talk about mental health, which Ghanaians, we barely touch that, we barely talk about mental health, but we really need to talk about that. And then we also have pediatrics, if you have kids, they also I talk about that and the benefit of enrollment and other stuff. So this is free of charge, right, Dr. Okoe?
It is absolutely free of charge. And so it's a clinic we just started back in November of 2021. So it's 6 months now, and it's a mobile clinic. So, our first event was actually at the United Methodist Church. on the north side, but like the past 3 or 4 clinics have been at the Ghanaian Presbyterian Church on the south side. This upcoming month in May, it's actually going to be on the north side. I can't remember the name of the church, but it's on Wilson, and if I'm not mistaken, Wilson and Sheridan. Do you have the flyer with you?
I do, but I don't think it has it on it.
Okay, I'll give you my phone number. My phone number is 773-575-3088. If anyone texts me, I would send the flyer to you. But it's a free clinic. We try to have all the main services. So we have general medicine, we have myself, which is gynecology, and then we have specialists that come in. So we did all of the physicians and the nurse practitioners that come to the clinic. We are volunteering our time to this clinic because we feel very passionate about this. We want to serve the community and provide them with the services that they need. The other services we have there is we have an in-house pharmacy with a pharmacist, and we also have benefits where we have a benefits specialist that can get you health insurance if you need it. If you need assistance with filing for Social Security, they can do that as well. So we check, what the host said, we check all of the, your basics, your weight, your height, your blood pressure and things like that. So please come out and support. We have clinic the second Saturday of every month. Like I say, it's a mobile clinic, so we do change the location depending on the needs of the community. But my number is here, so please text me, and then I will send the flyer to you.
So, Dr. Okoe, can you talk more about this that health clinic? Because that's what we do. The issue, the main goal of our show is to create the awareness that this is a problem. So let's go see our doctors and stuff like that. So do you have any experience to share as to how some of these, maybe someone came there and there was an issue and there was a consultation and other things?
Yeah, I mean, we like I said, we touch on different things. Some people, I mean, they may not have like extremely high blood pressure, or their sugars may not be uncontrolled, but at least like we try to provide any service that we can from a medical standpoint. And like I say, our benefits specialist, she's amazing. Okay, so like, it doesn't matter what your immigration status is. You can be undocumented, you can have green card, you can have U.S. citizenship. We'll see you, and whatever's we can do to help you. If it's like getting you established with medical insurance, if it's getting you established with an actual doctor, if it's getting your children vaccinated, because we actually have vaccination clinics for COVID. I think in August we may be trying to set up a pediatric drive to get kids vaccinated to go back to school. So we try to do the basic needs of the community, but anything else that is needed, we're there to help. Like even talking about infertility, we had a gentleman that had infertility issues. So we were able to put him in contact with a urologist, or that's a doctor that specializes in male reproductive health or urinary issues. So, we and like our pediatrician, she comes from Champaign-Urbana. So like she may not be there every clinic because of her work schedule. But, we try to provide a holistic care needs to the people in the community, and it's free. We do blood work. There may be a fee for the blood work, like a nominal fee, but in terms of seeing the providers, because we're doing this on a volunteer basis, this is our way to giving back to the community. So our services is free to the community.
And this is done with the collaboration of the Ghana National Council, right?
Yes, the Ghana National Council is the main organization that kind of help like give us the funding, help with some of our funding and publicity. So Ghana National Council is the main organization that we function under, and then the other organization is Ghana House Incorporated, which is a subset of the Ghana National Council.
Yeah, so these events are really, really nice. And the thing that I want to touch on is sometimes, we Africans and Ghanaians in general, like, we really don't take up these opportunities, right? This is free. Instead of going to a doctor and then being charged. Anytime you see a doctor here in anywhere in Chicago or around the US, they're going to charge you because their services are not free.
Even I think for us, that's not, that of course is what we know is one barrier is finances, right? But another barrier we find is that sometimes when you go to a doctor, they may not understand your context.
That's true.
They may not understand your background. They may not understand your culture. So because like all of us on the who volunteer at this clinic, for the most part of our Ghanaian heritage, either myself who's American born but had Ghanaian parents, or those that actually come from Ghana. We come from various tribes, some are Hausa, some are, Gan, some are Ewe. And then, but even we have one of our nurse practitioners, she's Nigerian. So we try to provide a cultural context to the healthcare so that we actually can get, can control whatever issues you have and make it more personalized to our people. So being free is one thing, that's an incentive, but we also want you to know that we're providing care to the community in a setting that people feel more comfortable, like discussing their health needs and actually getting the treatment that they need. That's our biggest goal, is being able to provide culturally sensitive care to people so they feel comfortable and actually become well. And also one other last thing I want to stress is that it's confidential. So I don't want people to think that their information is being spread out into the community. We do this as a living outside of this clinic setting. Okay. And so, whatever professionalism we have, at our work is the same level of professionalism we bring to the community. So we want people to feel safe and be reassured that whatever they discuss with us is held confidential. And our goal is just to provide the best care possible to our people. And that's our goal.
All right. So to wrap up, we're just going to say that right after this, passports will be coming on, and then I think OBG Ghana series is also going to follow. Obi, he asked, does fibroids also cause some fertility? Yes, we talked about that.
It does.
Yeah, she said it does, but that's not the only thing. There are a whole lot of other things that causes infertility, but fibroid is just a little piece of it. And so Dr. Okoe, can you just wrap up what we talked about today so we can let you go and then pick you up on what you
So pretty much today's show was about just giving a general overview of fibroids, like how common is fibroids in a community and in women in general. What are the causes of fibroids? Some of the ways that we treat it, main thing is birth control pills if you just want medicine and not surgery. Obviously, we could do surgery to remove it if it's really a big problem. We touched on how fibroids can be a cause of infertility, but it's not the only cause of infertility. We talked about how infertility we look at it in whole, not just a woman problem, but it can be the male factor too. And we treat, whenever you come to a specialist, they look at the couple as a whole. And then obviously we lastly talked about the clinic, the free Ghanaian community clinic that's been started, and, just trying to get people to come and get the services that they desire and need.
Dr. Okoe, I want to thank you very much for coming on our show. And like you mentioned, we will come to you again. I think on our program, we have you doing other things. But, I know you do so much for the community. I've seen you on Trend Africa show. I've seen you so many places. And I do follow you. Like I mentioned, we've not met, but, I've seen you in so many places that you're championing health in our community, which is really, really good. And I want to thank you for that.
Well, thank you. And hopefully now that COVID is is starting to become more controllable. Hopefully we get to meet in person one day.
Oh, yeah. We would like to have you in our studios one of these days. All right. Thank you so much, Dr. Okoe.
All right. Thank you.
All right.
Bye-bye.
So we go for commercial break, and then when we come back, we might have PowerPoint start. Other than that, we move on, and then maybe they might come later. Thank you so much, Dr. Okoe.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.
World Remit, a better way to send money. Download the app or visit worldremit.com.
Wow! Me pa na fi ma file me tax including dia kwa mami. Na ene se afenu akwawiye me tax file na beye me asompidie ene nkwadana. Nanso with Akunim and Associates say die me nyo butantim e me tax issues ahodi nyina mu. Onua wow anything e was file or tax with smile. IRS for editable atoso. Womu hunehuna, womu tata, wo file or taxa. Dapia da uboka, usika unya ekituebi. Make no mistake. Fahobo Akunim and Associates. With Akunim and Associates, what tax filing ebedano S gracia ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing, and NSM, Akunim and Associates. State BIA Iowa America, Kroponimono, Mepacho, Womu Ewo, GDA, Anamon Quine, Pasua, Wombetime True, Akoshem Quan, Ewo, tax filing. Ain't baby Bia Ubia, Utimi, any Akunim and Associates, Etokese. Najuma Dian Obonti, Akunim and Associates, a deal Bia the friends Ura gender, not just say, Wakudarimu, Abeng, our tax filing. Fawobedan Womo, Shishawana Chi Quine, our offices, Audua, Edisui. First location, 684 West Boughton Road, Suite 201. Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchaf Wanum Ewo. Telephone number 773-6101-112. Number Nibium is 773-6101-112. 01112. One fax number is 708-247-3454. I feel bit my email no akunim.info@gmail.com. Akunim and associate, yes, no crane open kunim die tax mudia. This is what took us with Akunim and associate.
Ba eni ma me dufi o yedwuma odukasi anopa biara me nua ba sori ahoɔden mu na ɔkwadwuma on complain da tell him ba bitutu no sanso na me bra o efitani o tu engine na o pagya engine de ka adwuma sɛ de sitie da bi biara no ho dendenden me ameyire o store no adi ni dwa me yire ensori anopa enka sɛ na nia ha anase ne ho yɛ ne mreda sanem papa ne mfia konkan ɔno so complain da tell him ba bia ne ya ɔsori anopa na no afanse kan na ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de bedampo na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kuani eyaduru a wonom a ebo ni padua no ma wo se pi usita me kanfo ama wo se won so no nom kowa mesani bi na ba boa na aboa no obusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. So wo pe kwa mixture ato ewa America brochi memu call One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonana Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadie nkratoyi yi agiatum se eye.
Yo, we dey take for Hana Benome Kwame me do dwuma de nyina na oba na wiye. And then so dey care na Dr. Okoe na twetwe nkomo efa Fibroids and Fertility ho. So they know what kind of. If it's about back to another series, the same series now with images. I hope some no motivate a man come. I must be number same time next week. They also be some for Manu from the series of Okoe Radio, Macram.